We begin with the pandemic. The Biden administration is expected to announce that all fully vaccinated Americans should get booster shots 8 months after their second shot. The latest CDC forecast predicts the number of COVID hospitalizations could rise to 32,000 per day by September 13th. Trevor Alt has the latest.
Just hours from now, the Biden administration expected to address the country about booster shots and their recommendation that all Americans get one 8 months after they got their second dose of the Pfizer or Moderna vaccines. That expected new guidance comes as Israeli scientists release new data showing Pfizer's vaccine was less effective at preventing severe COVID symptoms among those 65 and older who were fully vaccinated in January.
We're picking up evidence of it, certainly through breakthrough cases, and so the level of effectiveness has gone down from over 90% to 40 to 50%, and possibly breakthrough hospitalizations.
This as America's COVID crisis deepens by the day. ICUs across 5 states now more than 90% full, including Texas, where Governor Greg Abbott announced he's tested positive despite being fully vaccinated, saying he's asymptomatic for now. Abbott has banned mask and vaccine mandates in the state, as has Florida, where in the Tampa area, more than 8,000 students and faculty are in quarantine just a week into the school year. In Louisiana, doctors noting a change in who they're treating.
It's something that's so different than last year. Last year it was lots of patients with comorbidities. The patients we're seeing now are about 10 years younger as an age group. We're seeing 20-year-olds and 30-year-olds on ventilators.
And as we now see the highest number of pediatric hospitalizations over this entire pandemic, Arkansas father Kyle Buttram speaking out as his 1-year-old son Carter is on oxygen in the hospital.
Get vaccinated. That's all there is to it. Get vaccinated and help your family.
And ABC News has learned the federal government will be extending the mask mandate for travelers on planes, trains, and buses until at least January, meaning COVID restrictions are now stretching into 2022, a full 2 years after America's first case. Diane?
All right, Trevor Alt in Baton Rouge, Louisiana. Thanks, Trevor. And let's bring in physician at Stanford Children's Health, Dr. Alok Patel, for more on this. Dr. Patel, thanks for being here. It was just last week the FDA authorized booster shots for immunocompromised people and said the rest of us don't need them yet. So what changed?
Well, Diane, you're exactly right. And good morning to you as well. And it was just last month that most scientists and physicians in this country were saying, hey, we don't see any reason to believe that immunocompetent or people without underlying medical conditions will need boosters at all. What really changed is twofold. There was evidence in the lab that some of the antibody effects were waning or going down, which is not surprising. And there's just new data out of Israel. What we all want to see today from the White House is what exactly tipped us over into a recommendation. Is it just those two components, or is there more evidence that people who were vaccinated are still not only getting breakthrough infections, but are spreading this as well? And I think that's what's going to be really important for transparency and to really convince people about the need to go out and get a booster.
And is there any sense yet of why that 8-month time period?
I do. That's another part of what we would want to see from the White House. And I know that people have been watching the antibody effect, but that's only one component. We know that the vaccines give you long-term memory immunity, but it's possible that the lowered antibody levels in people are causing them to get hospitalized. But again, like I mentioned, we want to see evidence that over the past month, more vaccinated people have been spreading this, not because that's a good thing, but because that justifies the need to get these booster shots. And remember, Diane, boosters are not uncommon. We see them in the hepatitis vaccine, polio, measles, mumps, chickenpox, so many vaccines. So people shouldn't think that this is something outrageous or that this is proof that the vaccines don't work. That's absolutely not true.
So what kind of a timeline do you think we're looking at, and how will this rollout work?
Well, the timeline is looking to be mid-September, with the first shots being administered, if you recall, from December 14th. And based on that, the first people who got the vaccines were people working in frontline medical services, nursing homes, et cetera. So it's likely going to be those same individuals who are eligible in the middle of September, even though people have already run out there and tried to get their booster shots on their own. And so one thing that I worry about is that this is going to widen the disparity we saw in delivery of the vaccines earlier in December. But on the plus side, the government does have over 100 million shots in reserve and a lot more facilities to administer these vaccines. So they suspect that it'll go much smoother.
Now, most of us experienced more side effects from the second shot than the first shot if you got Moderna or Pfizer. So what side effects can we expect from a third shot?
I was one of those people. I was put down for a day after the second shot. Totally expected. Now, in Israel, I saw a survey earlier surveying about 4,500 people, and they said that they had received similar or less severe side effects from the third shot, from the booster. And so that is good news. It does make sense in terms of your immune system. If you already have some antibodies, perhaps there's less of that immune system reactogenicity from a booster shot. But Diane, it's still a concern. We see frontline healthcare workers right now stretched to the brim in these overflowing hospitals. The last thing we would want to hear from are physicians, nurses, frontline workers unable to work efficiently while ICUs are packed. So that is a point of consideration in many parts of the country right now, those side effects.
All right, Dr. Alok Patel is expanding our knowledge on vaccines and our vocabulary today. Immunocompetent and reactogenicity. Did I say it right?
Nailed it.
Dr. Patel, thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.